My name is Marsha Vasserman. I am a pediatric neuropsychologist at the Alberta Children's Hospital. I work primarily with evaluating kids and their thinking skills, and we'll be talking about the neuropsychology of congenital heart disease and how heart disease can affect brain development, thinking, learning, social emotional skills in children. So, just a little bit about what is a neuropsychologist, because not everyone is familiar with that or what neuropsychology is. Neuropsychology is a specialty, it's a subspecialty of psychology where the focus is on brain behavior relationships. So, what we do is we evaluate cognition, we evaluate thinking and learning and memory, which can be affected by a wide range of medical diagnoses. And our goal is to identify both normative and personal strengths and weaknesses in a particular individual to develop recommendations for how to support that child and their family as they go through school and their life. You may be wondering why we're talking about the brain or why a neuropsychologist is involved in congenital heart disease when the issue is with the heart. So I'm going to talk a little bit about that heart-brain connection and how these two organs are forever linked both in development and throughout life and the impact that one has on the other. So the heart and brain are connected from the first month of fetal development. The heart pumps blood, which carries oxygen and nutrients throughout the body. And our brain utilizes about 20% of the body's oxygen and calories, even though it makes up about 2% of our actual body weight. So therefore, that connection alone, knowing that there might be a reduction in blood flow, would lead to a reduction in oxygen delivery, can have some potential influences on brain function. The other piece that we are becoming aware of is that there are a lot of influences that influence both heart and brain development simultaneously. The heart and brain develop in parallel, and even though the heart is fully developed much earlier, the same genetic and environmental influences that can affect heart development will also affect brain development and potentially impact alterations in development as a result. One of the things that we're seeing recently is that the impact of that brain-heart connection is seen in babies with heart disease even before they are born. So when we look at group-level MRI data of fetal brains, these babies' brains look different. They're smaller, there's alterations that we see even before birth. So alterations in fetal blood flow may lead to reductions in oxygen that is going to the brain. We know that congenital heart disease also changes fetal blood flow, especially in cyanotic heart disease. The other thing to really understand is that the fetal brain oxygen consumption is almost half of all oxygen consumption in an unborn baby. So they are using 50% of their oxygen for brain development. The heart also supplies that oxygen demands and nutritional content by 4 weeks of gestation. So very early on, the heart is one of the main ways that other parts of the body, including the brain, start to get that oxygen and nutritional content. And by the third trimester, brain metabolism, growth, and organization become very, very dependent upon adequate oxygen and nutrient delivery from the heart. And so we see a lot of those changes in brain development in that last trimester of pregnancy and congenital heart disease. So what are some of the potential impacts on brain development and function? So we talked a little bit about those in utero changes in oxygen that are related to changes in fetal blood flow. The other areas that can impact brain development and function include all the things that kind of go hand in hand with moderate to severe heart disease. There could be brain microinjury that is sustained during significant surgeries, long length cardiopulmonary bypass, and other life-supporting interventions like ECMO. There's decreased oxygen saturations that we know a lot of these kids have, especially prior to some of their surgeries, and that will affect blood flow to the brain as well. So when we look at the brain development in kids with congenital heart disease, we see a couple of patterns. As I mentioned, one of the things we see is that these brains look different before kids are even born. Brains tend to be smaller of kids with heart disease, and that alone will predispose them to be more prone to other injuries. Those lower oxygenation levels throughout childhood. Some kids have low oxygenation levels for the first several years of life before some of their surgeries, and that will frequently result in white matter injury. And then, one of the things to think about is that brains are developing in the context of continued illness, continued interventions. And so those kids' brains are developing a little bit differently as a result. There are a couple of risk factors that we know can affect the likelihood of having some white matter injury or brain injury. Cardiac arrest that results in a total lack of oxygen delivery is definitely a big risk factor. And needing life supportive measures like ECMO seems to be a risk factor for cognitive struggles as well. There could be some other reasons for developmental and cognitive difficulties as well. We're still trying to better understand all the different pieces that kids with heart disease experience that might put them at risk. A lot of these kids have lots of hospitalizations, which lead to reduced opportunities for learning and socialization, and that definitely needs to be taken into account. Children with significant heart disease are also at much greater risk for neurological comorbidities, so having a stroke or epilepsy, and that will put them at risk for cognitive struggles as well. And overall, we see a lot of white matter injury that is occurring before surgeries. So we know that the major risk burden for some of this brain development piece happens outside of the surgical period and really is happening before and potentially after surgery as well. So what are some of the cognitive findings? We know that just having some changes in brain development does not necessarily have a one-to-one correlation with specific cognitive skills. But when we look at kids with heart disease overall, especially moderate to severe heart disease, we do find some patterns in kind of how their thinking skills develop. They tend to have slightly lower overall intellectual functioning skills compared to kids without any medical issues, although generally as a group, they're in that low average to average range. So generally intelligence develops normally. And much of the difference in those intellectual functioning scores are related to what we call nonverbal reasoning. So things like visual spatial perception, pattern recognition, things that require visual spatial function rather than verbal abilities. And we know that specific diagnostic groups like hypoplastic left heart syndrome tend to have more impairments in IQ, whereas some other groups like tetralogies and TJAs are less likely to have IQ impairments. Language is generally an area of strength for kids with heart disease and tends to be pretty preserved. There is a higher risk of speech and language delays in early childhood for kids with heart disease, and there is some potential for difficulties with pragmatic language, which I'll address a little bit later. But generally, vocabulary, verbal reasoning skills, being able to communicate expressively and understanding of language tends to be an area of average skills. Visual spatial skills. This is a common area of difficulty for kids with heart disease. And what this means, visual spatial skills are those skills that require you to kind of take some visual information, be able to manipulate it in your mind, put a puzzle together, especially in your head, navigate a map, navigate a space. In some studies, we see that these visual spatial processing difficulties are also associated with some aspects of higher order academic skills like math. And we've seen the struggles both in visual closure, visual motor integration, which means kind of copying what you see, and just basic visual perception as well. Motor skills are also an area of difficulty for a lot of these kids, especially fine motor skills. So whereas large movements, gross motor skills like walking and running and jumping are often on track, the fine motor skills tend to be an area of significant struggle that persists over time. So this includes just basic speed, how quickly you can manipulate small objects or your fingers, things like buttons and zippers. And having fine motor difficulties also tends to predict handwriting struggles, especially when they enter school. So handwriting is something that is also impacted in kids with heart disease pretty regularly and often requires some intervention. Attention. So attention is something that is a pretty complex thing. It includes a lot of different types of attention. And generally, kids with congenital heart disease struggle across the board with focus and attention. This includes working memory, so being able to kind of hold information in mind just for a short period of time in order for you to be able to complete some sort of task. So if you tell a kid, hey, go do A, B, and C, they're going to struggle to remember the A, B, and C, and they might do A, but not C. Sustained attention, so being able to kind of sit there and focus on something for a long time, and dividing your attention between tasks. So being able to kind of flip back and forth, multitask, and split your attention between different things. Those tend to be areas of difficulty for kids with heart disease. Oftentimes, these are not visible until kids enter school because that's really where the attentional demands start to increase, and you might start to see some struggles in those focus and attention skills as kids get a little bit older and more is expected of them. So executive functioning is a term that gets thrown around a lot these days. It's a pretty popular term, I think, in the field of psychology, but there's no clear definition of what that means. And so people might be talking about different skills when they talk about executive functioning. So as an overview, executive functioning is an umbrella term, and it has a couple of different skill sets underneath it. And that includes things like inhibiting your responses, not doing something when it's not the right time, being able to resist distractions, plan and organize, everything that we need to be able to orient our behavior in order to reach some sort of end goal. And this is an area that a lot of kids struggle with a lot of medical conditions, and definitely kids with congenital heart disease have a hard time across a lot of these tasks. Executive functioning skills are very widely dispersed throughout the brain, and therefore they're much more susceptible to any sort of alterations in brain development. And so difficulties in executive functioning have definitely been noted both on performance-based measures, so these are things that we do in our offices during our assessments, as well as behavior rating scales. So when we ask parents, what does your child's organizational skills look like at home and at school? Parents and teachers will often report some difficulties. They often struggle with problem solving and cognitive flexibility. So being able to shift between different types of thinking and different types of tasks. Planning and efficiency is also an area of struggle. And then inhibition and working memory. So being able to resist an impulse, not call out, not say what you're thinking when it's not appropriate, and then be able to kind of keep track of what you need to do. And one of the reasons that this is also important to think about is because we know from literature in other medical conditions that weaknesses in executive functioning are known to impact medication adherence and medical management for complex chronic conditions. So kids who have executive functioning difficulties often need more support and will often have more difficulties in managing their own heart disease when they reach to that kind of teenage years and adulthood. So this is something we really need to be thinking about as kids transition to adult care. Learning and memory. So when we talk about learning and memory, a lot of families will come in and say, my child has a really bad memory. And what they mean by that is that my child's attention is poor. So when most people think about memory, they think about, I told you to do these 3 things and you didn't remember them. And as I talked about it a little earlier, that's really more of an attentional skill. When we talk about learning and memory, we're really focusing on being able to learn material and retain it for a prolonged period of time. So for example, once you learn something, once you really know it, do you forget it over time? And the findings within this domain seem to vary across studies. There's some studies that show some visual memory difficulties, but not verbal memory difficulties. And others kind of show that there's really no differences in learning and memory in school-aged children. It seems to be more likely to have memory impairments in kids with single ventricle congenital heart disease than other heart disease conditions. And as I said, the findings are pretty inconsistent. So some studies showed visual memory deficits in adolescents, while verbal memory was intact. Academic achievement, what we mean by this is your basic reading, writing, and math skills. Right? We know that kids with congenital heart disease have higher rates of needing special education services and have specialized program plans in school. They're more likely to get tutoring and remedial services in school. There's definitely a higher likelihood of needing school-based support. Despite this, many kids don't actually get the support that they need. And this seems to be in part related to schools not really understanding the impact of heart disease on learning and ongoing development. There's often a thought that, well, their heart condition has been addressed and they're healthy from a cardiac standpoint, and so now everything should proceed normally. And when it doesn't, schools really just do not understand how to support these kids and why they might need some extra help. Studies have shown that kids with congenital heart disease tend to struggle with math as well as reading comprehension and spelling. Processing speed, so how quickly you can process simple information, and executive functioning skills, especially that working memory, being able to hold information in mind while you're working, have been implicated in the development of academic skills and are known to be impacted in kids with congenital heart disease and heart transplant. So we know that these kids are more likely to struggle with reading acquisition, comprehension, math achievement, problem solving, and then written expression as well. Overall, kids with congenital heart disease do tend to have higher levels of social difficulties when we ask parents about their social development. There's some risk factors in kids with heart disease that put them at higher risk for social struggles, and they include being male, having cyanotic heart disease, having higher levels of low oxygen before surgeries, as well as having longer surgeries and longer length of cardiopulmonary bypass. Some studies have also shown that even social cognition, so being able to take other people's perspectives in a more formal way, and pragmatic language that is necessary for social communication, are areas of difficulty. And then one of the other things to think about is that a lot of these kids, especially early on, have much more limited experience that supports social development. They're spending a lot of time in hospitals, a lot of time around adults. They have less opportunity to interact with kids in those early years. And so that also puts them at greater risk because they are missing out on some of those developmental opportunities. There is a higher incidence of autism spectrum disorder as well in kids with heart disease. And we're not exactly sure what the driving force for that is. It could be some genetic aspects that result in higher levels of autism and heart disease. Could also be some developmental pieces. So that's something that we're still working on figuring out. In terms of emotional and behavioral functioning, overall, those who undergo heart surgeries, heart transplant, have a higher rate of psychosocial risk. Kids and families have higher rates of mood and anxiety symptoms that might require treatment. These are often very prolonged and traumatic paths that families end up going on as a result of their child having heart disease, and that does lead to a good amount of emotional symptoms that need support. There's high rates of ADHD symptoms and behavioral externalizing difficulties, especially in younger kids. And like I said, parents often have a higher level of emotional symptoms like depression, anxiety, and even post-traumatic stress disorder as well. So knowing all of this, the goal of sharing this information really is to support families, to support parents in advocating for their child's needs. So what can you do if your child is struggling? One thing that I recommend is always talking to your cardiologist and treatment team. Because over the last several decades, we have become much more aware of some of these neurodevelopmental concerns that kids with heart disease struggle with. A lot of programs have developed cardiac neurodevelopmental surveillance programs. There are official guidelines that were put out by the American Academy of Pediatrics in conjunction with the cardiology groups that really guide clinicians and hospitals and clinics to screen and assess kids with congenital heart disease pretty regularly. So many programs will have some sort of way of addressing neurodevelopmental concerns, or at least identifying them. So talking to your cardiologist and treatment team will help you learn if your clinic has something like that, right? They might be able to refer your child for assessment if there's cognitive concerns. If there's concerns around attention and ADHD, they might be able to refer you to a pediatrician or a community counselor if there's social emotional concerns. At Alberta Children's Hospital, we have begun a cardiac neurodevelopmental screening program where through parent questionnaires, we're screening kids with moderate to severe heart disease to identify those kids who might need a little bit of extra support or who might need additional assessment or referrals to community resources. If your child is struggling with those executive functioning weaknesses, they might need more strategic and hands-on support as they transition to more independent medical management. This is where behavioral psychology can also be really helpful in developing kind of expectations and realistic goals and behavior plans to support kids in taking on more responsibility. And then here at Alberta Children's, we also have the Transition Navigator and Children's Link, which help support families through that transition to adult care. And this may include a neuropsychological evaluation as well if there's cognitive concerns. The other thing that you can do that I really urge parents to do if their child is struggling is talk to your school. You might have to be the one to educate them on the connection between the heart and the brain and heart disease and development and learning. Schools often do not know this. Does your child have an individualized program plan or an individualized learning plan? If not, they may need one. Schools will rarely come to you and say that your child needs one. Unfortunately, parents are the ones who really have to push schools to provide some of that support. Some cardiac teams will also have an educational liaison. So this is a person who will work with you and the school and the hospital to really get the kids support. And if your team does have an educational liaison, get them involved. If your child does have an IPP, read it. Are the goals specific to what your child needs? Many IPPs are rather generic. Some are wonderful and have very specific goals, long-term goals broken down into short-term goals, but many have just very generic goals. So you can guide your child's school to develop goals that are more specific to your child's needs based on what you see them. And then also requesting services and resources like occupational therapy, physical therapy, speech language therapy. Many schools do not provide one-on-one therapeutic support in schools, but they might provide consultation support to the teachers to help your child within the classroom. And some government programs will provide consultation to the family as well on how to address some of those needs in the home. And then for older kids, making sure the transition goals are included in the IPP. Kids who are 14 and up, those goals need to include self-advocacy, independence, and transition to whether it be post-secondary school or job placement, right? We know that a lot of kids with heart disease are going to need a little bit of extra support as they transition out of high school into adulthood. And so making sure that that's included in the plan is really important. Well, thank you. That was the end of my presentation on the neuropsychology of congenital heart disease and the connection between the heart and the brain. If you would like to learn more, we will be hosting additional presentations and workshops for parents on a wide range of topics within neurodevelopment in congenital heart disease.